As you now understand, it is really important that the urine comes out from the body. In the urologist toolbox, we have lots of different catheters in order to help patients with inability to empty their bladder fully. The first catheter I want to show you is the stay catheter or Foley catheter. A stay catheter or Foley catheter is this one. It has two channels inside and it has a balloon in the end. The balloon is filled up with fluid in order for it to stay inside the bladder if the patient has to have it for a longer time. Therefore, it is called a stay catheter and it has a Foley balloon. It also comes in smaller, shorter sizes for females. The next type of catheter I want to show you is a one-channel catheter. The one-channel catheter is used for emptying of the bladder. It doesn't have a balloon, so it has to be removed after the emptying. Therefore, if a patient uses this to empty their bladder, they have to use it a couple of times every day. It also has different sizes. Size in catheters can be measured in length or also in circumference. The circumference of the catheter is called charrière or French. Catheters also come in different material. Here I show you two different materials. It's the standard catheter, which is a latex catheter covered with material in order to reduce the allergenic properties of latex. If a patient has latex allergy, we prefer to use a silicone catheter, the other one here. Catheters also have different kinds of tips. That is the outmost part of the catheter. It has a bent tip or a straight round tip. The bent tip is used in order to help and guide the catheter going up into the bladder in a male. Therefore, it is important to keep track of the bending of the tip so it doesn't bend the opposite. Then it will be harder to put it into the bladder. Here I have different types of catheters. With one-channeled catheter, a two-channeled catheter and a three-channeled catheter. Why do we have three channels in a catheter like this? Well, it's in order to irrigate the bladder. Irrigation into the bladder is important in patients with hematuria. It looks like this on the inside. You can see that there's a main canal in the middle for emptying the bladder, and there are two other channels in this catheter. One to the balloon to make it stay in the bladder, and one for irrigation and infusion of fluids. This catheter is also a special catheter that is a little more rigid than other catheters. That is also a big help in patients with hematuria. In the special cases where we cannot reach the bladder through the urethra, we have to put in a suprapubic catheter. That is a catheter going through the abdomen into the bladder, through the skin of the abdomen directly into the bladder in order to empty the bladder, because it's so important to empty the urine from the body. So this was just a demonstration to tell to you that we have a catheter for everyone.